Last but not least, context matter. So reason I say this example is that when AI is only as useful as what the context get. And I mentioned that if you guys are building your own kind of models in your organizations, you want to make sure you have the right information that makes sense. You can't just use an off the shelf model because it's not going to have any context about what you are. No matter how many times you talk to it, it's almost like it has to relearn who you are. It doesn't have that persistent memory unless you do certain things around it, to kind of with, project tools and Claude and other things. But the key here is to remember that, context will always matter. An example I gave is like in this question is that I raise my hand to request a server come to the table or take my order. That word server in the reference to this context means that this is some kind of computer. But server could also be another context if you're at a restaurant, right? And so making sure the context matters in the sentence structure, but also in what data you feed it helps the AI become more effective. And so when you're kind of thinking about your workflows and using AI and you partner with technology partners, keep this in mind, right? So that when they're building for you, say for, hey, how's it going to happen with it if this fast change and quick change? How are you guys handling that, right? How are you handling, ways for my organization to, have the context I need, right, to build these out. So when you're building out workflows to help with burnout, these are something that is, endemic to what you're building out for the future. And that's something to keep mind of as we've seen, as we kind of work with organizations. The fix isn't more automation, it's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, click the link below, check it out, and give us a call if it makes sense.